Let's talk about tight end for the Philadelphia Eagles, Dallas Goedert. While he was running with the ball down the sidelines, he got tangled up with one of the defensive backs for the Dallas Cowboys. And as he came down, his forearm got twisted. He was experiencing immediate pain, and so the sports medicine staff took him underneath the stadium and they got an x-ray. He was then ruled out for the rest of the game due to a forearm fracture. So when we look at the forearm, there's actually two bones that comprise your forearm. There's the radius that's associated more along the side of your thumb, and then there's the ulna that's associated more along the pinky side. And when we look at the shape of those two bones, the ulna is actually a little bit smaller, and so typically it's the first one to get fractured when we have a forearm fracture. Now, what we find though is that when we encounter forearm fractures like what Dallas Goedert had, it's typically within the middle of the shaft of the bone, kind of how this diagram and this x-ray shows. If it was closer to the joint, say by the elbow joint, they would have reported it as an elbow fracture. If there was a fracture a little bit closer down by the wrist, they would have also referred to it as a wrist fracture. Because they referred to his injury as a forearm fracture, we can likely assume that the fracture or the break in the bone occurred right in the middle of the shaft, similar to these diagrams here. We're not exactly sure which one of the forearm bones that Dallas Goedert broke, but again, we can likely assume that it was at least the ulna. He ended up getting an MRI the next day on Monday just to make sure that there was no ligament damage up by the elbow or down by the wrist, just to be sure, because if there's enough force going through his forearm to break a bone, you want to make sure that the joints and the ligaments aren't affected as well. When we talk about the way that fractures can heal or bones can heal, we have two different types. Let's talk about the second type first, which is termed secondary healing. And so with secondary healing, what happens is you have two fragmented ends of the bone, and your body will naturally form a bone bridge to connect the two fragmented ends. Over time, we can monitor that through repeat x-rays to see how well the bone bridge is forming. And then eventually what will happen is the two ends will come together and your body will form a bone callus or a little bit of an overgrowth around there. And then eventually your body will then form mature bone that's healthy and ready to take on different activities like football, basketball, or any other sports, as well as weight-bearing push-ups and things like that as well. The other type of bone healing that can occur is called primary bone healing. And this is termed primary bone healing because some type of external equipment is needed to actually bring the two fracture ends together. In secondary bone healing, the fracture ends were apart and your body builds a bridge that then kind of merges the two together. In this case, with primary bone healing, we're actually taking the two bony ends and we're merging them together and then fixing them through some type of instrument like a plate, screws, or even a rod or a nail that goes right down the middle of the bone. Now, the reason why Dallas Goedert is actually undergoing surgery for this to get that primary bone healing is because he can return to the game a little bit faster. When we don't have to wait for that bridge to occur between the two bone ends, and somebody like an orthopedic surgeon can just put the two bone ends together and lay down some instrumentation to allow healing to occur right then and there, we know that the athlete can return a little bit faster. And given that this is professional football and that's part of his job, we're looking to return, in this case, Dallas Goedert, to the field as quickly as possible. Now, there are a couple reasons why you may undergo primary bone healing or surgery for a fracture in your forearm is if the fracture is displaced and so it's angulated or it pokes through the skin or it's split into a few different places as well. But with Dallas Goedert's surgery, we're likely thinking that it was just a simple fracture with surgery to bring it together. Now, there are a couple complications that can occur after surgery. One of which is infection, which that's a risk for any surgery. But given that with this type of procedure, there's a large open incision in order to place the plates and screws in there, that's a potential site for infection, especially if the athlete's still trying to work out their other body parts like biking or sweating or things like that while the injury site is still healing. But more importantly, what we're also considering is that either end of the plate, so in this case, both on the top and the bottom part of the plate, while the bone is super strong, the natural bone that the athlete has, the plate and the titanium metal is actually a little bit stronger than your body's natural bone. So what happens is right at the either side bookended for that plate is actually a weak spot for the bone. So super strong along that plate, but then right at either side, north and south, there's a potential weakness there. So what we saw with Gronk a couple years ago when he had this fracture is that he ended up fracturing the same forearm again because the plate is so much stronger than the natural bone. And so he ended up fracturing on one side of the plate. So something to consider as well as the athlete's progressing back towards the field of play. Even though Dallas Goedert elected for surgery along his forearm, and we know that that's going to accelerate his time to get back out on the football field, there's still a few rehab milestones that we need to achieve before he can comfortably go back to the field of play. The most important thing is that we need to regain the wrist and forearm range of motion. So after surgery, he's going to be placed in a splint or a cast just to protect the healing site. A lot of times after this particular surgery, people will lose wrist extension more than flexion, but wrist extension is going to be really key. That's going to help to make sure that he can brace for impact, go up to block if he has to as well. The other thing is that after this particular procedure, people will lose the ability to supinate or turn their palm up. So that's going to be a key factor as well, because that will help his overall arm strength and mobility, just to be able to get that palm up mobility back, as well as his grip strength. So these are things we need to consider as we're starting to progress him back to the field of play. There was a study done in 2018 that actually looked at NFL players and surgery to fix their forearm fractures and how likely they were to return to their sport. And they actually found that most NFL athletes are able to return to sport after this type of fracture. So we'll see how this plays out for the Philadelphia Eagles playoff push.